Hi, this is Dr. Myckatyn. If you can let me know if I'm on.
Yep.
Okay. Hi, this is Dr. Myckatyn from West County Plastic Surgeon. Sorry, we had a little technical glitch with our video camera and our computers. There must have been an update. So today we're going to be talking about gynecomastia surgery, which is essentially surgery to create or to fix male breasts or male breast tissue. So gynecomastia comes in several different variations. The main issue is that there is breast tissue, or sort of almost like a breast bud of thick fibrous tissue that sits underneath the nipple and the areola. And the areola is like that bump that sits underneath or is the areola is the pink tissue that's around the nipple. And so basically what can happen is that tissue can get thicker, it can become tender, and it can cause men to be a little bit embarrassed by the appearance of it, but it can also cause pain and discomfort. And while it usually happens on both sides, left and right, there are definitely occasions where it happens just on one side, or maybe it's a little bit worse on one side than the other. And it can also come and go. In other words, it can be worse at certain times of day and then better at other times. Certain activities can also exacerbate it as well. So that's the most common form of gynecomastia that we address. A couple important things about that is many men, probably most men during adolescence, do develop a little bit of excess breast tissue, and that's normal. And it's normal for that to be there even for up to a couple years. It becomes more of an issue when it begins to go, when it persists past about 2 years. And so that's when we start, keeping a closer eye on it and thinking of solutions to try to fix it. But there are other forms of gynecomastia, or sometimes what we call pseudo-gynecomastia as well. Gynecomastia can also result from having just excess tissue, either through weight gain or through weight gain followed by weight loss. So therefore, sometimes it's the fibrous tissue, sometimes it's due to fatty tissue, and other times it's due to a lot of excess skin because somebody gained weight and then lost it after that. And sometimes it can be a combination of those as well. And so you can imagine, since there's different things that are causing it and it can look different ways, there's definitely different ways to treat it. So when somebody comes into our office and they're considering doing something about their gynecomastia, there's going to be a bunch of different stuff that the plastic surgeon is going to want to know and ask about. The first thing is going to be when did it show up? And as I said, in many cases, it's actually a normal thing that it develops, but then that we would expect that it go away. But other than just naturally occurring, there are different causes of it that we also need to rule out. So it can be due to changes or fluctuations in hormones. And so one thing that is important is that we'll, for example, check to see if there's any other issues going on. If there's changes in the testicles in terms of changes or development of masses, for example. Sometimes it can be associated with different liver conditions, kidney conditions, very rarely certain types of glandular tissue, and even brain tumors also can also be associated with gynecomastia in rare cases. It can also be associated with the use of various types of medicines. Anabolic steroids can cause it. Marijuana can cause it as well. certain types of diuretic medicines, seizure medicines, and actually a fairly long list of medicines have been associated with gynecomastia. In elder men, it can also occasionally be associated with lung cancer. And so we kind of ask a lot of those types of questions. Sometimes if there are concerns, we'll actually have our patients see an endocrinologist first. Sometimes patients are referred to us from an endocrinologist. And then also, while people don't think of it very often, male breast cancer is also a real thing, particularly in families that have a strong genetic predisposition to breast cancer. So especially if it's just occurring on one side, and especially if it's kind of come out of the blue and it wasn't something that developed in adolescence, but later in life, we also want to make sure that there's not an underlying male breast cancer. So those are the types of things that we're thinking about as plastic surgeons when we're looking at our patients. So once all that stuff is ruled out and we're comfortable with kind of the cause of the gynecomastia, then when we do the evaluation, we're thinking about kind of what's causing the problem. So is it just the fact that there's this disc of tissue that's underneath the nipple, and there's not a lot of extra skin, and there's not really a lot of fatty tissue? In those types of cases, it's really about removing that disc. Typically, there's a semicircular incision that's made underneath the areola, and it's made right at that junction between the pink skin and the white skin, and that's done to conceal the scar well. And then right through that incision is where we cut out the gynecomastia tissue. In some cases, that can be associated with a little bit more fibrous fatty tissue. And so in those types of cases, we'll also use liposuction to suck out the tissue. There are definitely cases where the bud is not that prominent and it's just fibrous tissue. We use a specialized form of liposuction when we do those types of cases, and it's called ultrasonic assisted liposuction. So with standard liposuction, what we're doing is we're injecting fluid into the area that we're treating called tumescing fluid, and that contains a drug called adrenaline, which your body also naturally makes, and that's to constrict blood vessels to reduce bleeding. And then we give a drug called lidocaine, which you often will get at the dentist, for example, and that's a local anesthetic, which is used to numb the area for a couple hours. And then with that given, we can then suck out fluid with reduced blood loss and with no pain. However, that may itself not be enough if the tissue is very fibrous. So what we can do with gynecomastia patients is after we've given that numbing fluid, we pass through that same little 0.5 centimeter to 1 centimeter incision a probe. And the probe also goes through that same area that we're treating. And the probe emits sound energy. And essentially what the sound energy ultimately does is it causes the little bubbles that are in the fluid that we had injected to expand. And that actually causes the fat cells to dislodge and to liquefy. It also does generate some heat to allow the overlying skin to tighten around it a little bit. And that allows us to kind of get through and break down that fibrous tissue much more effectively than just straight up liposuction. And then once that's done, then we do the rest of the normal liposuction steps. So we put what's called a cannula in, and we suck out the fluid and the fatty tissue that we disrupted. And then our patients will wear a compressive gown after surgery to essentially sort of mold the skin and the soft tissue over their muscle frame. And that's basically the procedure. I prefer to do my cases generally under general anesthesia. We'll sometimes do touch-ups in the office, but most of them are done under general anesthesia. I think it's much more comfortable for our patients. But people go home the same day. It's very rare for us to use a surgical drain. We occasionally would use them, but not very much. We use the compression garments more. Most folks can get back to work within days. We're not cutting or muscles or breaking bones or anything like that. So recovery is really just dependent on when somebody feels a little bit more comfortable. Most people would say that it feels like a really intense workout, that they're pretty swollen and sore for several days before feeling better. Now, there are different other versions that we will do. So if somebody comes in and they have a lot of extra skin, for example, from weight loss, then we can't remove the skin just by making a little cut underneath the areola or by liposuction. The skin will not come out effectively that way. So essentially, to think of it as your skin suit is too big for your frame. So we need to reduce the size of the skin suit. And so that's why we have to remove the skin. One of the more common ways is to try to position the scar, because when we cut out skin, there will be a scar, is to try to position the scar sort of in a natural crease underlying the pectoral or chest muscle. So that's the most common place that we'll put it, but that can vary a little bit just depending on the amount of skin or how the skin is distributed. In those types of cases, we do use surgical drains to reduce the fluid, and that will be in there for probably about 7 to 10 days in most people. So I think the important things to know are that as plastic surgeons, we're trying to figure out what the cause of the gynecomastia is. In many, many cases, the answer is we don't know the cause, and that's called idiopathic, but it's important first that we look to make sure that that's the case. The second is to kind of figure out what the actual issue is. Is it the fibrous tissue? Is it the skin? Is it fatty tissue? Is it some combination? We want to make sure that if whatever that process is, that it's stable, so that we're doing our surgery when somebody's body is at the shape it's going to be when we operate, and the shape that it's going to be for years to come. And then we want to make sure we're removing skin, or removing fat, or removing gland, where the scar is going to be, and making sure that our patients understand where those are going to be and why they're there. Now, what are some of the major complications with gynecomastia? I'll start by saying that it's, in the grand scheme of plastic surgery, it's a very safe procedure. The complication profile is pretty low. I do think that the main things would be that you can lose nipple sensation, especially if we're removing a lot of glandular tissue and soft tissue around the nipple and we're cutting it out. Gynecomastia can come back. There is a limit to the amount of tissue that we can remove, particularly since the glandular tissue is literally attached to your nipple and your areola. So to ensure that the nipple and the areola remain alive, have blood flow and nerve supply, there is a minimal amount of tissue that we need to keep attached to it. And so as a result, there is some of that tissue that formed the gynecomastia in the first place still there. So in a percentage of individuals, if there's further hormonal fluctuation down the road, for example, then they can still respond and develop gynecomastia again. Certainly, too, if somebody were to gain weight, they can have more fatty tissue, and that can come back. If somebody were to lose weight, they can develop more loose skin. And so those types of things can occur. So again, just to keep that in mind when considering this type of surgery. With that, I want to thank you for watching our video on gynecomastia from West County Plastic Surgeons. I'm Dr. Myckatyn, and please keep an eye on our Facebook page as we dive into other plastic surgery topics here, which we do on a weekly basis off of our website and our Facebook page. Thanks very much. Happy New Year. I hope you're well, and I hope you get vaccinated, and we look forward to seeing you soon. Thank you.